I'll be presenting to you a lecture about the dental photography. It's more a bit of a technical more than a scientific lecture about the methodology and the techniques and the equipments that we need for a good dental photos. And I hope I can give you some tips and tricks on what camera to choose and how to do the technique. Okay, out first, let's talk about the dental photography. Why do we need dental photos and for what purpose? And what are the requirements of those pictures? It should be a good, high quality, representative pictures of what is the dentist seeing in the patient's mouth. So we want to acquire as much as details as we can to the photo that we can save it on our hard disk for the following purposes: for the observation and inspection, and for the diagnosis, or for the purposes of follow-up or demonstration and education. The subjects that we are taking photos for are the teeth, anatomy and the form of the tooth, the color, soft tissues, and prostheses, and the dental materials, and also the dental instruments. Here is the basic dental photo set for the pictures that we should take if we wanted to have a case to compare it before or after. That's another example of the pediatric patient. And a third example. And that's an example of a close-up picture that is during a procedure. The options that we have to use is the digital camera and the intraoral wand camera and the professional SLR camera. All are good options and can give me what I want. But the most versatile and professional one that gives me the best results is the professional SLR camera. It gives me photos that I can use in the presentations, and those photos are textbook quality, can be used in posters and even in billboard advertisements. So the equipment that we need for the professional camera is the camera itself and the appropriate lens and the close-up flash and the lip and cheek retractors. Finally, the dental mirrors. So about the camera, the minimum requirements that this camera should be at least 7 megapixels and should be accepting the macro lens, and this camera should be accepting installing a close-up flash. Okay, Canon or Nikon or Canon is not a big dilemma, as huge choice is upon your preference. What do you prefer? Each brand has its own equipment that you can use it for doing this purpose. Here's a schedule for the lineup of the models of each brand. I recommend that you use those cameras here. Plus means good, this very good, or excellent. That's for the Nikon and the Canon. Okay, done with the camera. About the lens that we need, it should have the following properties. It should support the autofocus, and preferably we need a macro lens, but it's not a must, and also should be able to zoom in and out. Okay, that's the lens that comes with the camera. It's fair enough if I just wanted to have the basic photo set. If I wanted to have a close-up pictures, like the one that I showed you before for the implant, you might need the macro camera, which gives you the top quality. This picture, for example, is taken by a macro lens. You can see all those details, and you can even have a closer one, and even closer than that. That's with the macro lens. Okay, moving to the flashes that we would use. The flash should be capable of being installed on the lens of the camera, and it should be multi-directional. So I can have the flash from the right and the left so there, it should diminishes the shadow that appears in the picture. Okay, those are different types of the flashes I might use. You can see here the Nikon and Sigma and MITS. Not necessarily the most expensive is the best. As you can see, this one is the cheapest, but it's the most compact and the most preferable to me. This one is kind of huge here. You can see it's a large setup. This one is wireless. About the retractors, mainly we have two types, the plastic cheek retractors, or we can use the Columbia metallic sheet retractor, which I prefer. It's better for handling. And for the dental photography mirrors, we need a mirror that is autoclavable for the infection control, and we also need a mirror that is resistant for scratching. So the glass is preferred over the metal because of the scratch resistance. And we need special photos, not a normal mirror, some special mirrors that were made for this purpose. Why? Because they are chromium plated. That's the metallic mirror, and the glass one comes in two pieces, the lateral one and the occlusal one. Now we have the full equipment to start doing our procedure. That's a picture of a disparate land. I took it in South Africa, maybe because his wife was shouting at him. General tips. Before we go on, we should have some points in mind that the dental light unit should be on at some distance to aid me in the focusing. And the patient should rinse his mouth. Then we do some suction and gentle air drying, not total drying, because we don't want to see any air bubbles or saliva bubbles in the mouth. Okay, for the mirror handling, we should keep it in a warm water to prevent the fogging. And about the settings, I will give you a brief idea about the main numbers that you need to know about. This is called the ISO, here in the Nikon and here in the Canon. And that's the shutter speed. And that's called the f-stop. I will tell you what numbers you should use. It's a fixed numbers that you do not have to change. Okay, step number one to change those numbers to the preferred numbers is to click on that button on each brand here. Then use the arrows. After that, use the dial pad to change the value of the setting to the preferred one. For the camera settings, the shooting mode should be on M, which is manual, and the white balance should be on this sign, which is flash mode, means flash mode. So you don't have you don't get a bluish picture or reddish, a medium. And the ISO should be 200. The shutter speed should be 1/80. These are the fixed numbers that you need if you have the full equipment. You don't have to change them. Manual mode and the flash. White balance, ISO, and that's the shutter speed. Okay, then we come to something called the f-stop, which is really important. What about the f-stop? F-stop is located here. We need to put it on a high number, more than 20. Usually the standard is 25. Why? Because if you put it on a low number like f8 here, you can see that the focus is just on the anterior teeth, and the posterior teeth are out of focus because of the small number that you have here, the f-stop. But if you put it on a large number like 25, you will have all the teeth in focus. That's a further illustration. F8 gives you only this area, the small one. F25 gives you the whole field. That's the difference. Okay, and there is a nice setting that I like that you should use it if you noticed after taking your picture that it's a little bit bright or a little bit dark. You don't need to think about the hustle of all the previous numbers. Just change this one. It's called the EV, and this one is the flash EV. There's a flash sign here. As an example, it's located here in the screen. As an example, if you got that picture and you think it's darker somehow, and you need to have a brighter one, just change the value to a positive one, then you will have a better brightness. Then I would advise you to turn the viewfinder grid display on. This is the grid display. When you look through the viewfinder here on the camera, you will see the grid display, which aids you in having a good balanced picture and aligned. And the focus area should be a single point. These are the focus areas. When you put the camera on automatic and you just click half a click, it will automatically choose the best point according to the camera's mind. But if you put it on a single point focus, you will tell the camera that I want you to concentrate here, or here, or here. You choose the point. See here, you look through the viewfinder, then you select the point which is most convenient. Usually we choose the closest object to us when you are looking through the viewfinder that we want it to be in focus. Then everything that's behind that point would be in focus. Okay, single point, as I told you. And those settings are for those who don't have the full equipment. If you just have your camera, you don't have the ring flash and the full setting, you might use those numbers. The ISO, you can put it between 400 and 800. F-stop, you might put it on 8, but you will end up having some blur effect, not the whole teeth are in focus. And the white balance, you put it on that setting, incandescent or the sunlight. Why? Because now you don't have a close-up flash, or you will be needing some light from your dental clinic to aid you in overcoming the shadow problem. That was taken using a macro lens. Okay, now we are ready, and that's our dentist well prepared for taking the photos. That's the basic dental photo set that we will go through picture by picture. The first one is the frontal picture. You have to make the chair position in the upright, and the instrument that we need in the corner here, the cheek retractors, 2 pieces, and our camera. And the dentist position should be on the side. Okay, that's what you would see in the clinic. You take your camera, and the focus point, as I told you, the nearest object you want to be on focus. Afterwards, all would be in focus. Okay, now the mandibular picture. The instruments that we need is 1 cheek retractor and the occlusal mirror, the wide one. The chair should be slightly reclined, and the dentist should be on the side also. Okay, taking the shot here, the occlusal mirror and the cheek retractor, and we define our focus point. Now the lateral picture. The chair position is the same, slightly reclined. We are going to need the other mirror, which is the lateral one, and one cheek retractor. And the dentist should be on the side also. Now that's what you would see in the clinic. We always focus on the mirror. See, I'm aligning the grid here, the middle line, according to the occlusal line as possible. All right, now we go with the last photo, which is the maxillary. The chair position should be fully reclined, and we're going to be using the occlusal mirror as well. But the dentist side this time should be over the head of the patient. Okay, taking the shot, aligning it with the grid, and selecting the focus point. That's my hometown, Jeddah. Okay, now we're gonna talk about something important after we took all the photos, which is the photo editing. Those are some suggested software to use for a fast and quick editing. We should do it always in that sequence. Brightness enhancement, then the rotation, then the flipping, cropping, resizing. Any photo that you take using the mirror, you should always flip it. Except the frontal, because we didn't use the mirror. Okay, that's a video for the editing. Now we are doing the brightness modification, the preferable one, number 1. Then fixing the image rotation. Of course, that's the area that we want here on the mirror. Image flipping. Then we crop it. Then the resizing, which is the last step. Okay, because of the time limit, that would be the last step in our presentation. And thank you very much for the good listening. If you have any questions, please do ask.
Okay, thank you very much for information, and now I would like to give your certificate.